Good afternoon, ladies and gentlemen. Is it? Oh, it's not yet afternoon, it's before noon. No, yeah. So, good morning, ladies and gentlemen. I'm very happy to introduce the next keynote speaker. And it sounds very interesting topic, Mood Master course. So we're going to hear something innovative from Pavlo Kanellakis from United Kingdom. Dr. Kanellakis is a chief investigator in a very big research project, and now we are going to hear about his work. Welcome.
Thank you very much. Can you hear me? Can you hear me? Can you hear me now? Yes, I can hear myself, so I think you can hear me as well. So, a number of people have been asking what is Moodmaster, and I just realized that the gadget about the slides is here. So, but before I tell you a bit more about Moodmaster, I will explain a bit more what I'm doing currently. Indeed, I work for Health Education, West Midlands. So West Midlands in the UK, which is halfway between London and Scotland. That's why they call it the Midlands, the middle of the lands. And we are looking at how we can best educate health professionals across disciplines, so across medicine, psychology, social work, occupational therapy, nurses, and people that work in the training departments, but also unregulated staff, so assistants, many of which are, for example, psychology graduates. What's the best way to train them in psychological skills? And a number of you recently have been describing the challenges in the financial market at the international level, that we have shrinking budget both within the education sectors and the health sectors. And therefore that becomes a very important question for us. Being such an important question that will influence the funding of the training in the West Midlands and across the UK for the next 10 years, a lot of resources are allocated to that, and we have a very large team. So the topic somehow is influenced by my thinking from my current job, but actually it started when last year we were in Antalya in the last conference. So those of you who were there, it was a large lobby, very long lobby, a massive lobby, very beautiful, and on the last day, I remember sipping peppermint tea and thinking what would be relevant to share with you as the past chair this year's conference. And I thought, well, there needs to be some ingredients that we have been discussing about how we engage learners. It needs to be something that is relevant to each one of you, despite our diversity. It needs something that it can have an impact on the people you work with and for you as an individual. A number of you have been reflecting on the importance of reflection, of critical thinking, of critical reasoning, in the way that we practice, in the way that we are role models, and the way that we train our trainees. Something ideally that you know little about, so hopefully you will go away with something new. And that's where the idea of the Moodmaster came. So what is it? Well, as part of what I will cover, I will tell you what and who is Moodmaster, how did it develop, a description of the sessions, how someone can become a leader of Moodmaster groups, how does it fit in comparison with training people through simply giving them recommended reading. How does it fit in with interactive or computerized learning? and also some other aspects, for example, linked to the contributing to the development of Moodmaster. I want to acknowledge that there is a relationship between this speech and the workshop that I will be doing tomorrow afternoon. And I completely took on board the ideas, and I was very much thinking along the same lines when we were discussing about flipping in training. So the workshop has a very strong experiential nature. It has not only a top-down, but also a bottom-up component, which is part of the flipping. It involves group discussions, and I will explain a bit more about the conversation about how flipping is very much part of the workshop. So there are some spaces left, so if you want... I see. And I don't know what to do that. Possibly check it. Any better? Any better? No, that's very good. It's important that you hear in a way without distractions. So thank you very much, Dad. So, we're discussing about what we will cover in a bit more detail. Let's move to, so what it is a bit Moodmaster. They are structured programs for professionals to deliver to groups of people. They're designed to provide knowledge and skills people need to reach their full potential. They're based on cognitive behavioral therapy, as recommended by the United Kingdom's National Institute for Health and Care Excellence. And they're pre-written with built-in mood monitoring, in-session discussions, and out-of-session projects. So all the professional needs to do is to present them. So as part of this, I'd like to focus on the importance of the structure. In a lot of the research we have done is that when things are structured in learning, there are some benefits. So although there are a lot of benefits in flipping, also there are benefits for professionals and for participants to have some structure. The benefits for the participants include that they know where they are going. The importance for presenters is that their anxiety is reduced, and it helps, therefore, to be able to engage better with the audience. Yesterday we were discussing about self-regulation as well. And we're talking initially about self-regulation in children, but of course it's a skill that starts at childhood and develops in adult life. So it is important to think about the emotive components, emotions, which is linked to mood, and that's why the course is called Moodmaster. Also to think about cognitions, the thoughts we have, and also to think about the interaction with those for behavior. Big interactive principle within cognitive behavioral therapy. The other aspect, of course, is the flipping, and the in-session discussions are very much linked to flipping. So the groups are very much interactive rather than having huge didactic focus. So the idea of the Moodmaster programs is to enable group leaders to provide relevant and helpful material to group members, as well as a forum for people to reflect on what they do. Important the notion of reflection, because reflection is very much linked into learning. Reflecting both on what has gone wrong, at times where we cannot ignore it, but most importantly, on what went well. Because by focusing on what goes well, it helps both the learner and the environment to thrive. Professionals want to operate at their maximum, and Moodmaster programs help people to just achieve that. So very much fits with the learning and training value of helping all humans to reach their optimum. A very humanistic principle and a very much a principle that is linked to the values of all teachers. So if people can see that they are looked after and cared about, their morale and effectiveness may follow the same upward path. Definitely when I can think about situations when I have been at my best, it was when I felt supported, cared for, and that enabled me to provide the best. I assume you may have had some experiences where indeed you were at optimal performance. And you remember the diagram yesterday where having a lot of challenge is helpful so people do not get bored, but having also a lot of support is very important in order to reach flow and optimal performance. So this approach is based in a lot of integration of the research findings over the years regarding learning. So who are they? They are a company called Association for Psychological Therapies, and they're funding Moodmaster, and they have developed the content and they're administering. Now Moodmaster and APT, and they have trained initially in the UK 93,000 professionals, actually over 93,000 professionals in the field of psychological practice. And then they have expanded the pilots in Canada, in places in Europe like Greece and Malta, and also they have run some pilots and some courses in the Middle East. So it's important to acknowledge, therefore, that all that previous knowledge got integrated into the development of those programs. This picture is Will Davis. Dr. Will Davis is the academic director of APT, and part of the discussions took place around the idea that many people have never learned the basics of psychological health, the fundamentals which are likely to produce psychological well-being. So it is sometimes easy within the health sector to focus on the people with the most complex needs. But also, there is a vast majority of people that they may lack even basic information. Even if people do not lack basic information, sometimes we do not apply basic information. And any help to utilize and access that knowledge is seen very, very important. So things like how to organize your life, how to get a good night's sleep, how to manage your emotions, how to have good relationships, how to manage your thoughts. They are very important topics, and there is a lot of psychological literature on this, a lot of research on those. Some of that is in the public domain, but the way that they are presented, it's difficult for someone to digest them, especially if they are a lay person or someone who is not trained at licensing level as a psychologist, whether that is an educational psychologist, clinical psychologist, or health psychologist, counseling psychologist, etc. So then the next step was to form a group to agree what these fundamental ingredients are. So there was a group of 4 psychologists, the academic director of APT, 2 clinical psychologists. One of them, I believe, although he lives in the UK, is from Iran, and another one who is attached to Durham University up north, plus one university professor from Leicester University, which APT are based at. Again, they are part of the Midlands, East Midlands, met to debate and eventually agree on the topics. An important component after that was translating the topics into spoken English. So easy to read out aloud and professionally artworked into sheets designed to be attractive, accessible, and succinct. A lot of the research and the experience of the training 93,000 professionals has indicated that this is a key ingredient. I won't bore you with the details regarding the factorial analysis done regarding the evaluation sheets from the 93,000 participants, but this is a lay version of explaining some of those concepts. So then a pilot study commenced, interestingly, again in less in the Midlands, by putting 28,000 flyers through letterboxes and trying to open the model to everybody like Weight Watchers. Weight Watchers is an interesting case study, first of all because Weight Watchers has reached many cultures and many countries, and it is a strong brand name. So when we're looking at organizational case studies of what can we learn from outside the field of psychology that we can integrate within psychological knowledge, that came as an interesting example. So the study happened in a room above a public house. Many of you may not know what a public house is, but you know the expression pub. So pub is an abbreviation of a public house. And pub, of course, you know it's a place where, it's an English pub, so it is a place where people can socialize, drink alcohol or drink soft drinks, but it is a hub of community, and it used to be a hub of community in the UK, and especially outside London. This is still an important area. So often pubs, or some pubs, have also a room they often let out, and often in that specific pub they had events like Weight Watchers. So over the trial, initially they have had a pool of about 20 people. And this is important again because Moodmaster is a program that each one of you can deliver. It is a program that's aimed at health, at professionals in education, in health, in various sectors. But one of the things they have discovered is, as part of the pilot, that the group format was attractive to members, so they liked the fact of the flipping, they liked the fact of the peer support. And actually they were sad to see the pilot study end and made comments like, "This just transformed my life." And ratings confirmed the subjective observations that even severely distressed people benefit from the sessions. Actually, the people that were even more distressed were managing to make the biggest difference. Of course, partly this can be understood as part of, it's easy to detect big differences within ratings, but also at some level it's an interesting finding because you may think, well, this is something that it has to do with health settings, it doesn't have to do with education, but that's not actually the case. On the other hand, they acknowledged that not anyone could become a trainer, but possibly teachers, an ideal group that can become trainers, because teachers have knowledge of how to teach groups, they have knowledge of how to manage the group dynamics, inspire, motivate, and a lot of the psychological literature on education psychology is about reinforcing positive behavior and learning and applying that learning. So I have just covered that notion. So I'll give you a bit more a sense of what the sessions are like. Although I want to acknowledge that the workshop, the aim of it is to be completely experiential. So you will have experiences in the workshop of being a group member of two groups. One of them will focus on music and how music can be utilized. Again, We selected that because we thought that would be appropriate, a topic for a number of you as you're involved with the teaching of music, but or with creative arts, but also because it's a topic that a lot of us are very much influenced in so many ways. Music is often around us all the time, and it has a massive impact on our mood. The other topic we'll look at the workshop is how the thoughts that constantly we're having, either when we're silent or when we actually even engaging with others aloud, really influence how we are feeling. And what are the things we are doing, a number of occasions, to help us that we are feeling better rather than feeling worse. So trying to distill in each one of you, how do you do it when it works for you, that component. So very applicable, very relevant to your individual experiences, very great opportunity for you to benefit as an individual, but also have a felt sense and interact with people, not from a top-down, but a flipped way. So let's look at this slide. They are to teach people the skills necessary to maintain psychological well-being, people meaning employees, students, 11 upwards, although it can be applied in inpatient and psychiatric facilities, and in their training program, there is a specific education tab within their website, and educational psychologists have been involved in that development. So a standard format for each session: mood monitoring and learning from experience. Each person rates the previous week and considers mistakes and successes for that week. Mood monitoring is really important for the literature. When we look across the studies, we know that awareness of how someone is feeling is a really critical component for change. Change means either maintaining good mood or a sense of well-beingness, psychological well-being, but also if someone is not feeling well, to be able to do something about it. Learning from experience is part of the flipping aspect. Instead of simply hearing the information from others, it's about how someone engages from their own learning. Because in trials, we have two kind of methodologies in general, to generalize. We have qualitative research that tries to map differences on the terrain, and then the quantitative research, although it looks at issues like degrees of divergence from the mean, at the end of the day it tells us what works for most people. In order to apply that to an individual, we need to think, and which of that knowledge applies to that individual. If it is relevant for 99 other people, but not for you as an individual, this is not really relevant for you. So the importance of subjective experience of an individual is very significant. Mistakes are important, but also what we know is learning from successes is most important. Imagine that you are driving a car and you lose control of the car. The temptation would be to try to focus where you're going, because you think, oh my God, I'm going to hit a tree, a gorge, a wall. It's human nature. However, what we know, that the best way to bring the car back is to look to the direction you want to go, not to the wrong direction. We know that from every other aspect of teaching. Every time that we focus on unwanted behavior, we reinforce that behavior. So, again, the experience from the 93,000 trainees indicated this component. The leader asks how the homework went and leads a discussion on the responses. We know that there are 168 hours a week. And again, as part of flipping and how engaging learners, although having an hour's time to touch base it's important to utilize the rest of the time, and that's the time where people apply skills, experiment, try things out. If it is not important, when people are in a session with us and we ignore it, what kind of message does it give? But we devalue it. So it's a contradictory message. So that's why it's so important, and the research again indicated that as a key ingredient. And there is a topic of the day. This is part of the structure and having a focused approach. So by having specific topics that research has indicated that they are helpful for participants to know about, it is anticipated that this is a mix, and not everybody will learn something new in every session, which is completely fine, because this is linked with self-efficacy. If we are overstretched without sufficient support, then it can lead to low morale and disengagement. So also consolidating to what people are doing well was found to be very important. So we mentioned about the weekly mood ratings, which serve as a measure of progress, and this forms of part of the developing evidence, both across the groups, but also in terms of the individuals, because it's great, again, if it works for other people, but if it doesn't work for one individual, that's really key piece of information for that individual. And the structure means that the sharing of bad ideas is minimized. Now this is the shadow side of flipping. Sometimes you may have seen as teachers that although groups can produce wonderful aspects and great creativity, groups also can bring in humans some of the worst behavior. We can see in human history about some of the atrocities that we have done as groups, and we know from social psychology about the impact of dynamics. So this approach does not necessarily assume that any idea is a good idea, and therefore new ideas are carefully filtered through. So new information is learned in the topic section, and it is practiced during the week. So this is links back to the homework. Through the research, we have identified that it makes sense to deliver the program in 5 sections. The master course, which is the big course, but also for people that they have low mood, as a clear presentation. Often students or colleagues experience low mood, and that's the main issue for them. This is sometimes different than stress and worry, which is the 5th category. Sometimes people experience irritability and anger, especially men. It may be culturally sensitive, but also it was found that it was easier to present something as a specific package for anger and irritability. And also especially because the project is utilizing a lot of research that the APT has done on the field of anger and irritability. So for example, they have issued, and Dr. William Davis has issued the Overcoming Anger and Irritability, which is the only anger and irritability book that is prescribed in the National Health Service as part of treatment to patients, as an alternative to medication. And then emotional control is a component about people having emotional stability, because some people may experience a lot of emotional dysregulation. A leader can choose which of the 5 to run, and they can run, for example, on Monday, one of them, Tuesday, a different one, but the recommendation is that, and actually the expectation is, in terms of for fidelity for the program, that simply people do not take some of the handouts from the first package and mix them with some of the handouts from the 3rd package, that there is coherence and there is a systematic approach. So the large program is 28 sessions, so it's ideal for those who are looking to provide an overall coverage of key issues in emotional well-being. And all the specialized options have 12 sessions and targeted at the topic in question. I want to say something extra actually about what the trial found. The trial found that also it's significant to run them as open groups, so rolling groups. So instead of running it for 12 weeks and then having a break and then restarting at some other future point, they have found that it's best if they run it on a rolling basis every week, and people can come in at any point that there is a space. That provides a good mix between people who already have some group ethos and know some of the information, so there is some kind of sharing of the ethos. And then people can opt out of the group and disengage whenever they have got what they needed. And that seems to have worked really well. Overall, the feedback, even from, this is an example really from a very senior psychologist in the UK, Dave Nash, which states, "My clients love it, care staff love it, and sessions are a pleasure to run it too. I really cannot think of anyone, service user or provider, or anyone really who could not benefit from joining a group." A very strong statement. The feedback from people has been very, very positive, and this is part of why I wanted to share this project with you. As it's a training conference, I wanted to also acknowledge some of the training requirements, how people are prepared to run the sessions. The training takes only 3 days, actually. We have found that this is sufficient. And in day 1, it's a session about what is Mood Master. And then there are 3 sessions of coaching, practice, and feedback. This is repeated on the 2nd day and on the 3rd day. So the biggest component is coaching, practice, and feedback, which I will explain in a moment. In the 2nd day, also there is 1 session about how to run Mood Master sessions. And the 3rd day is about the interlink between cognitions, emotions, physical sensations, and bodily sensations and behavior. So what's the significance of coaching, practice, and feedback? In the trials, we found that the best way is to demonstrate. The best way for people to learn is by experiencing and doing. So there are some didactic aspects, but because it is so structured, it helps individuals to learn quite quickly, especially educational professionals. And the very first time, the trainer demonstrates a session in which participants experience what it is like to be a group member, and they do not role play a client. The guidelines is to be themselves, and then they have opportunities to themselves practice and identify what are some easy gains and reinforce positive behavior. So that's part of practice and the feedback. Throughout, it's important that people learn the administration of the program, so also that is run as slickly as possible. So I just explained that the tutor demonstrates, they practice running them and receiving feedback, and this is repeated throughout the 3 days, so everybody gets the chance to be a group leader and group member. At the end, people receive a 12-month license, so successful participants, and Mood Master makes sure that people are supported as much as possible, so people can complete the course. I think it's important to have a period of 12 months because within that period, we need to see indeed people have the opportunity to practice, but also there is a point of reaccreditation to ensure that actually what people think they're doing is actually what they're doing. There is enough fidelity to the research findings, that there are aspects of also updating the material and keep them up to date with the latest developments. So it is linked with the statistics they submit. They need to, second point refers to fidelity and ensure that it is done to a high standard. And the third three-day refresher course entitles people to delegate the license after 12 months. Sometimes we are experimenting with having a web-based version of the refresher training in terms of the information components, as well as some distance learning reviews and discussions, for example, over the phone. Moodmaster is part of a larger platform, I want to acknowledge, that also captures in what was described yesterday as non-immigrants, people in terms of technology, because there is, for example, the Moodmaster apps that the Moodmaster and Impressional app had gone to the top of the iPhone iStore depression app list when it was launched. A very brief discussion about how does it fit with other parts of training that we might do. So, for example, it indicates that simply giving someone to read something, it is helpful, but it's not the same as to be an interactive element. And we can have interaction through computerized programs, but having the group interaction, that seems to be really, really significant. And for some people, that may be even better than individual sessions, individualized learning. I went to a presentation yesterday and they were talking about small groups being better than even individual sessions as well. Other aspects. We have found actually, this is interesting, it really makes a difference of how we give handouts. So, if handouts are given simply in a loose format, this seems to have significant impact on people's ability to follow the course, to value the course, and to keep themselves organized and benefit from it. It doesn't matter how you do it, but it could be plastic wallets or stationaries or shops, but that we found really significant. We mentioned about the feedback. There is a looping process as part of the development, so the program keeps on being refined in light of the future data. I mentioned about anonymized mood ratings as part of checking the efficacy. And again, another quote from the same person, who was saying that I think it should be regarded as a basic foundation for all health services, but especially mental health services, that they're interested in empowering their service users to be more proactive in taking care of their own feelings and promoting self-efficacy across the board. The title really says it all. Consultant psychology is a title that is used in the National Health Service in the UK for the most senior grade of psychologists, usually heads of departments. So let's summarize. Moodmaster Professional is the version that it has developed from the previous versions. It's a CBTB-based program to deliver directly to group members. The sessions have 3 sections that the research found useful: mood monitoring and learning from experience, homework review, topic for the day with associated project, and this works out at a very low cost per patient, per session, and high cost effectiveness when we compare with individual sessions or material that we are not utilizing any handouts. At this point, that was the end of the presentation. I'm happy for us to take questions and discussions, comments, anything really.
Thank you very much. Should I take a microphone or should I go? Maybe I should take it here. This was really interesting intervention and combining what we were talking about yesterday of flipped classroom and engaging people and also promoting structure and scaffolding for people to make such interventions effective. Are there any questions or comments? Well, we have time here now to talk about this a bit. I can give you the microphone if you wish. Or then I can repeat the question. I have also some questions.
Okay, sure.
I was, in the meanwhile, when you collect your courage. Well, we've been thinking about this when we are measuring, as I presented yesterday, asking students like 5 times a day, what do you feel right now and how competent do you feel and so on, and feeding them back their flow charts or something like this. We've realized that it's an intervention. And also in our university there are counseling psychologists, and we have a university psychologist for students, and we have a deal with them that if somebody goes really red with stress or exhaustion or is constantly in the anxiety channel, so we can give feedback to the student and to get more professional help. There is always this problem when we're dealing with lay people, if there are truly severe cases of depression or stress or something like that, that might be even dangerous for the individual.
My thoughts regarding that is, first of all, regarding the first point, indeed, we also find that monitoring of mood and associated components like efficacy is very helpful. We have found that going to the highest order possible was kept as simple for people to measure as functional rather than trying to go to individual components. And the idea about what is the liaison between educational staff that can run these sessions and counseling psychologists, for example, is that maybe if someone is acutely suicidal, it will be appropriate to refer on. But a lot of people may have very low mood and not be suicidal. And these people may not want to approach psychologists, and they won't, and they will be happy to engage with a teacher. So for us, this is a really important aspect, to see psychological well-being as everyone's business, rather than only a few professionals' business. Similarly with anxiety, if we think about exam anxiety, how frequent it is for students, but also for other colleagues. So some universities or some educational settings, schools, that they may have a specific service for their staff, but some places do not have that. And again, having someone to run those programs for staff can be very helpful. So these are some of the thoughts.
So it's like early intervention, so that we are preventing mental disease rather than curing those who are, when it's already too late. But it's also, now I'm looking at others. I'm sorry, this topic is so interesting for me that I started discussing with Pavlo. Do you want to join this discussion, or Hildur? Yeah.
Can you hear?
What?
Oh, I can give you the microphone. Actually,
it's about tomorrow, because I know that you're conducting a workshop tomorrow. What do you think is possible to achieve in those hours? Because you're presenting something which is held in 3 days, or?
Yes, so the 3 days is the training, and as part of that, people have indeed they experience the workshop. So this indeed will not be sufficient to train someone, but it will give you a very strong sense of what it is like being a group member. And because there will be two different topics, and I very much hope that each one of you will have something concrete at the end of it that you will be able to take and it will be useful for you as an individual and your students. So that will be part of the deliverables we anticipated. The way that it's structured, and you will see because there's specific format. But it's like cakes. Someone can tell us so much about cakes, but unless we taste them, someone can tell you about bitter or the ingredients, the flavor is unique, you know, we need to taste.
It's about experience.
It's about the experience, exactly.
Parents have questions?
Okay, are you familiar with Super Better, the program? If you on the TED Talk, somebody developed a program, a former game designer, and using you know, happiness studies and all across the spectrum of how you can, you know, well, mood master, influence your mood.
I'm not familiar with that specific program. Of course, we are familiar with the happiness research, as well as the depression research, and also the anxiety, anger, irritability, all of those different components and the neurological studies. But you know, in our reviews, that has not come up, and I would be happy to hear more about it at some point.
Any other questions, comments here? What if I would play a devil's advocate? What would you say if somebody asked, like, why do you need to teach people how to sleep and breathe and walk? There are lots of critical comments about these things, that everybody used to be able to take care of their lives and now we need professional people to help them.
Indeed.
So what would you answer for this kind of person?
That's an excellent question, actually. And interesting also that you said something about sleep, because the research unfortunately shows about the number of people that they have difficulties with sleep that has huge impact on their performance as learners is massive. And possibly we have adopted a lot of bad habits or bad influences and almost it is returning back to what each one of us knows being good for ourselves. So it's not necessarily a patronizing model of someone enforcing that knowledge on us, but it is supporting us in order to apply the wisdoms we know, plus distill hundreds of thousands of papers on sleep research into a digestible format. Because sometimes, for example, at least in the UK, in the media, we have the latest small piece of a trial and immediately gets flagged into the newspapers, especially because if it's controversial, it's eye-catching. The layperson may not be able to distill that in the context of all the research findings and seeing the larger picture, the meta-analysis. So this is what the value of being able to make that helpful. Very much the role of a teacher, really, because the teacher's role is to enable the individual rather than disable the individual.
Yes, and in our project, Mind the Gap, we are looking at sleep patterns of teenagers, because teenagers are very tired at schools and the sleep cycles are getting later and later, and it's very hard for parents to look after healthy habits, so to say. Yes.
Is there someone?
Is there, sorry?
You want the microphone? Well, not necessarily, I don't know if you can hear me. Yeah, I'm just at the others in the other end of
It's just a little question. I just wondered, this program seems to resonate quite closely with some of the mindfulness programs that are being developed everywhere. I just wondered what your thoughts were on that.
Sure. Mindfulness is an important ingredient of Mood Master. because, of course, mindfulness is based on solid research evidence.